Okay, so now antiviral, anti-TB. Can you see it? Can you see it? Can you see it? You can see it. Okay, so antiviral, we have two categories, non-HIV drugs and HIV drugs. So antivirals are going to work by killing or suppressing the virus, but it never fully eradicates it. So just thing to know. This healthy immune system works synergistically with the drug. So the people that are at risk are those who are immunocompromised. For non-HIV drugs, they're going to end in VIR, V-I-R. So acyclovir and oseltamivir. I hope I said that right. Who knows? Non-HIV drugs are going to impair virus replication, so the patient's own immune system will clean it up. Acyclovir, there's three different things that it can treat: HSV1, HSV2, and VZV. HSV1 is oral herpes, HSV2 is genital herpes, and VZV is chickenpox or shingles. And just a little thing to know, for HSV genital herpes, the outbreak is contagious the patient is contagious when they have an outbreak. So these are the things I just said. These are the things just to know about. So acyclovir is going to work for herpes, both oral and genital chickenpox and shingles. This drug, oseltamivir, is for the flu, but patients have to start this drug within 2 days of the signs and symptoms of the flu, and it can only be administered orally. For HIV drugs, typically patients who are receiving HIV therapy are going to have like a cocktail of several different drugs together. They call this HAART, highly active antiretroviral therapy. It's a cocktail of drugs to help suppress HIV so that the patient isn't contagious. The drug primarily used here is zidovudine. I hope I said that right. This is actually the first anti-HIV drug. It's going to block an RNA replication of the HIV virus. It's for, HIV patients, but HIV positive pregnant women can take this drug, and the adverse effects are going to be bone marrow suppression. So this does make the drug dose limiting, and just something you need to know about. For anti-TB drugs, these are obviously tuberculosis. It's going to be caused by Mycobacterium. The nursing implications for all anti-TB drugs are to take liver labs on your patient, monitor uric acid levels, take a baseline vision and hearing test to see where your patient's at the moment. Note that it is toxic in the elderly, so you need to know your patient's age. Obviously, patients need to take this drug the same time every day, and they need to finish the whole medication regimen, and they can take this drug with food. So there's 4 different anti-TB drugs: isoniazid, I hope I said that right, rifampin, pyrazinamide, and ethambutol. Probably not saying them right, but I don't care. You can see how to spell them. They're in dark green right here. So that's how you say that's how you spell the 4 different names. Isoniazid depletes B6, which can lead to neuropathy. So this is contraindicated in patients who are slow metabolizers or slow acetylators. And adverse effects can include peripheral neuropathy and liver toxicity. That's why you're monitoring liver labs. Rifampin can be used for more advanced diseases, and the adverse effects can include the bodily fluids turning red, orange. Nursing implication includes that the patient needs to use alternative oral contraception. Pyrazinamide, adverse effects include hyperuricemia, so or increased levels of uric acid in the body, and hepatotoxicity. So since it's going to increase uric acid and be toxic to the liver, it is contraindicated in patients who have gout and liver disease. But this is something that you need to know about this drug. Patients who have tuberculosis who also have gout, they still have to take this drug. They just have to, even though they have gout, they still have to take this anti-tuberculosis drug. So it's kind of like, which one's going to have a greater effect on your body? Okay, you're going to have gout and you're going to be in pain, but it's going to be getting rid of tuberculosis. So for these patients, you're going to be obviously monitoring liver values and monitoring uric acid levels in their body. Ethambutol, the adverse effects can be related to the eye. So neuritis, or blindness, and you need to take a baseline eye exam for this patient. So a way that I remembered this, where is it? Isoniazid has an N in it, which goes along with neuropathy. Rifampin starts with R. This is the one that's turning the bodily fluids red-orange. So rifampin, red-orange. Ethambutol deals with the I. It starts with an E, I. And then pyrazinamide, I just kind of see the G. I mean, I see a Y, but I think of a G because it's got the little swoop down thing. And I think of gout. And I know that gout deals with uric acid, with increased uric acid levels in the body. So this drug can cause increased uric acid levels in the body. So they're the antivirals and the anti-TB. I'll hold it right here so you can read it. I mean, I know that it was kind of a stretch with neuropathy and isoniazid, but I'm on a stretch and I don't care.